Good morning, Las Vegas. This is Tina Drago and Jim Godwin coming to you live from Beasley Broadcast Studio. Today's Healthy Nevada Today's Healthy Nevada segment is going to be on opiate addictions. How are you doing, Jim? What do you think about this?
I am doing pretty good this morning, and I think the opioid or opiate addiction is a crazy serious problem that's going on.
You know, we opened First Person Care Clinic with the whole premise of not prescribing narcotics. This was 3.5 years ago, and everybody kind of looked at me like I was leaving money on the table, so to say, you know, because there's so many people out there with pain addictions and stuff. And I said, that's not what we do. We're going to work on primary care, and we're going to let the pain management handle pain.
Yeah. Well, and that's, I say good on you, but just a quick glance, some of the numbers, there's been a 300% increase in opioid prescription sales since 1999. And that's without an overall change in reported pain. That's from the CDC. All these numbers are from the CDC. As many as 1 in 4 people receiving long-term opioid therapy in primary care settings struggle with opioid addiction.
So
249.
Where do we get all these people? 239 million?
249 million prescriptions for opioids were written in 2013, enough for every adult in America to have a bottle of pills.
That to me is just unbelievable.
It's unbelievable, and it's also not only the problem across the country, especially in the Midwest, but also in Nevada, we actually have more opioid overdoses, deaths from than automobile deaths. We have 1 per day. We're the 3rd worst in the country for opioid overdoses.
Do you think
it's a horrible problem?
You know, I see that there's like this layered effect on opioid addiction, and I look at it like we're this generation, this people who want a pill to fix everything, and I think that's a cultural issue, and that
is part of the problem. Is let's fix it, the instant gratification, which I had quite a big problem with throughout my 20s and most of my 30s. The instant gratification, but I think the problem is deeper than that. And what happens is people get stuck in these cycles of addiction. And the Surgeon General has written a letter, and Vivek Murthy, and he's started a campaign called Turn the Tide RX. And they have little commercials and stuff on Twitter with celebrities and whatnot talking about the problem. And it's a problem that needs to be addressed, and it's escalated, obviously, to a point that's just insane. And there's also problems with people not being cut off from their prescription drugs without being properly treated for their addiction. And then they go and switch to heroin.
Okay.
So they don't go through those horrible withdrawals because heroin. So what they did is when the opioid problem started rising, they started clamping down a little bit on the prescription of opioids. So certain people can't get them, so then they turn to heroin, which is easier to get and helps relieve those withdrawal pains, which are excruciating. And oftentimes your heroin or opioid withdrawals can be very dangerous, as is with alcohol withdrawals. They oftentimes need to be medically supervised. And people go out and they get heroin, which you don't know the purity of your heroin.
Okay, so
and that's how a lot of those overdoses happen.
We're 4 minutes into the segment, and we're at heroin overdose from opioid addiction. It's that slippery of a slope.
Well, there's still the opioids. The number of opioid addictions are way higher, and methadone are higher than the heroin addiction. But it's people that wouldn't be out looking for heroin that are, due to this the addiction cycle they get stuck in. And so the Surgeon General is doing a big campaign for awareness, and they're clamping down on your prescriptions, and you have to bring it in person and stuff. And a lot of that kind of helps, and it doesn't get to the root of the problem. which no one really quite touches on the root of the problem. The root of the problem is the big pharmaceutical companies.
Well, yes.
They started pushing OxyContin and telling the doctors to prescribe it more, which puts these people it increases their addiction cycle and has a higher turnover between the highs and the withdrawals.
So wait a second. I want to take us back. So this particular addiction, I know you could go on, but I really want to emphasize some points. This addiction, this drug addiction, hits everybody: grandma and grandpa, mom and dad, teenagers, homeless, wealthy, professionals. I have a neighbor that is a cop who was addicted to opioid pills from a job injury for 10 years. And he's walking around carrying a gun, protecting our people. This goes far more. This permeates the fabric of this country. This is not your typical drug addict issue here. This is everybody's susceptible.
Well, and that's another problem, is that stigma attached to addiction is another factor that enters into this big opioid epidemic that's going on, as a lot of people also don't want to think of themselves as addicts.
No, their doctor prescribed it.
They're like, no, I'm doing this. My doctor prescribed it.
Exactly. And
so a lot of people won't realize that they're addicted, or they won't seek the help they need due to the stigma that attached to addiction.
And doctors, and understand this from a professional point of view, doctors were kind of gullible coming into this also, and they're halfway through the river, and they're like, oh my God, I have maybe 20% of my patient population on opiates, and now I have to figure out a way to get them off, or I'm liable.
Well, that's another problem, is there is a big misconception that these pain relievers, like back in the early 80s and whatnot, that these painkillers were not addictive, they said.
Exactly.
And that, of course, once again, I'm trying not to attack big pharmaceutical companies too much, but they deserve it. And so that's another reason, is people and doctors are like, oh, that company that made the drug says, yeah, it's not addictive, and that also helped ramp up the problem as well.
And now they're finding that people can be on this drug as little as 3 days and have an addiction. And that really these opiate drugs should not be prescribed more than 2 weeks on the outside. And there's a reason for them. I mean, surgeries, major surgeries, things like that. You want your body to not be in pain so it heals better. There are reasons for them. It's not the evil, but it really needs to be looked at and controlled properly.
Yes, it does. There needs to be some major reform, and stigmas need to be detached from seeking help for addiction. It's nothing to be ashamed of, and that's also part of the problem too. That gives rise to these high numbers.
So we do the average. Let's just say something. I'll give two separate scenarios. One is I get rear-ended. I'm in a traffic accident and I get rear-ended. Okay. The other one is I go to the dentist and I have a root canal. Both those situations are having this narcotic prescribed for them, and both of them are opening you up to susceptibility for addiction. And
that's correct.
And I know I'm notorious with my dentist that he'll prescribe 2 weeks of I don't know, Percocet or something like that. And I'll go in there and I'll fill like 2 days worth and leave the rest, because I know I'm only going to need it for a couple days, and I'm not going to keep it around the house. And that goes to the second generation of users, are the people, that are you're passing these on to that weren't their prescription. Or you have
that is that is true. And it is that easy to get addicted. So, and part of the problem that caused it to grow to such large proportions was some of these drug companies coming up with, like, OxyContin is a great example. Mm-hmm. There's a pharmaceutical company that was on its way out, and they needed something big. And what people were looking for was a painkiller that would last an extended period of time, so they wouldn't have to take more. And this company, I can't remember the name of it right now. So they came up with OxyContin. Turns out OxyContin only works like 5 to 6 hours instead of the 12 that it was advertised. So doctors, their patients are coming back saying, yeah, it's not working the full 12 hours.
Oh.
And the doctors contact the pharmaceutical company, or those pharmacists, and contact the pharmaceutical company. And this particular pharmaceutical company that came up with and marketed OxyContin says, oh, yeah, just up their doses, have them take it more often, which also increases that addiction cycle of getting the high and then coming down low in order to sell more drugs and to make money. And if you look at how much money pharmaceutical companies bring in, you can see that I think that is the main fault for this giant opioid addiction, or these giant pharmaceutical corporations not caring about the people. And that's how that big OxyContin thing, and then that just kind of expands. And it also is helped balloon by the fact that human beings, since the beginning of time, enjoy getting high. It's just a fact. I mean, look at alcohol. That is a drug that's socially acceptable. But people like getting high, and that's another problem that gets you into the addiction. And the pain pills make you feel good. And then when you get stuck in that, and then when you go through those withdrawals and you're feeling sick and shaky and sweaty, and then you need opioid again just to feel normal and function. And then also, if you want to get that high again, you need to take a more dose of that opioid or opiate just to get the high.
So I'm going to read.
Where you get stuck in the big struggle.
I want to read you an article from Forbes, 2015. The richest newcomer to the Forbes 2015 list of America's richest families comes at a stunning $14 billion. The Sackler family, which owns Stamford, Connecticut-based Purdue Pharma, flew under the radar when Forbes launched its initial list of wealthiest families in 2014. But this year, they cracked the top 20, edging out our storied family, the Bushes, Mellons, and Rockefellers. They are the OxyContin clan. They are the ones who designed OxyContin.
Yeah, that's the company I'm talking about.
Now,
and
they are drug dealers. They are. This is short of cartel. I mean, if they were Mexican and smuggling in this drug, we would have millions and millions of dollars in resources out after them to try to stop them.
Yes.
But
and that's why you don't hear a lot about that, is because they have so much money, and so much money and so much politics is run by big corporations, as we've seen kind of highlighted during Bernie Sanders' attempt to run for president. And I think that's why a lot of the times you don't hear about it from the pharmaceutical company. Like, it gets a brief mention. The Surgeon General wrote this letter, and it just doesn't. They just talk about heavy marketing of opioids to doctors, and it doesn't really place any of the blame on those corporations. But I think that's where the main bulk of the blame lies.
There's so much spin doctors. Yeah, there's so much spinning going on, and I'm 100% with you that these pharma companies should be held accountable. They should be held accountable for their information, their misinformation, the people that are addicted, the families that have been ruined, under the guise that this drug was something good. If this drug was causing diabetes, or this drug was causing other issues, memory loss or something like that, the FDA would have been all over them. Over them.
That is true.
And they weren't.
It's rather unfortunate. And that was another cause of the problem growing bigger, is when they realized this was a problem, they started clamping down on the doctors and the offices and clinics across the country.
The pharmacies.
Some people just get, in pharmacies, they just get cut off. And then they're stuck there in this withdrawal, and they're not being properly taken care of. I don't know why that is, but partially I have no idea why. And so then those people are just kind of hung out to dry, and they go out and try and find that medicine illegally, which getting your prescription opioids illegally is quite expensive, and that's how we have people
Right.
starting to do heroin. You see a lot of that in the Midwest.
Heroin's
In fact,
cheap.
I can't remember.
Yeah.
Yeah, it's cheaper, and it allows you to continue functioning. And I can't remember, I think it's Ohio. I could be wrong. Somewhere in the Midwest, the police started showing they've had so many overdoses that they started showing the pictures of them finding the people overdosed.
Right.
And one picture that was particularly jarring was a couple in a car overdosed in the front seat with a kid in a car seat in the back seat, still alive. And it's a shocking, brutal picture I can't erase from my mind.
That's scary reality, though.
Mm-hmm.
I've had grandparents, geriatrics. We handle geriatrics in the clinic, and I've had their kids fight with the doctor because they want their parents to be given a pain pill or something along those lines.
Mm-hmm.
And we end up saying, well, our standard protocol is to do a urine analysis to make sure that they're taking the pills properly and that everything's in order. And we find out more often than not that the kids are selling the pills, or the nieces, nephews, they're selling them, and then they're giving dad and mom heroin. So I had a gentleman in, and I said, he tested positive for heroin, not an opiate. And, I said to him, how long have you been doing heroin? And he was like, I don't do that. That's street stuff. And the truth of the matter was his kids were taking his drugs and replacing them.
Oh, my gosh.
So
there you have it. More greed causing
it's crazy.
Problems.
So I look at this and it's everywhere. It's everywhere. If you look around you, you can touch two people. One of them's been affected by the drug, and you have to understand that.
And there's a growing, especially in the Midwest and in Nevada, being the third worst in the country, but a big problem in pockets throughout the Midwest. You can read articles about towns where they have like 20 overdoses in one day from heroin and other opioids. And it's just out of hand. I'm not sure what
Well, there's a couple things.
I think it's quite a few steps to take care of the problem.
Well, and there's a couple things. The pharmacy calls it the holy trinity of drugs. So if you have, so listeners out there, be aware. If you're on an opiate, there's opportunities to get you off this drug safely. And there's also other ways that you can take care of and manage your pain. So there are resources out there. It's just a matter of asking. But if there
are also non-opioid pain relievers as well, like Lyrica.
Yes.
And another one, I can't pronounce his name. But those are also nice alternatives as well.
So, but also
some people have problems getting those because the insurance gets more money from the opioids.
Yeah.
So sometimes a lot of people have problems. They want the non-opioid pain reliever for their pain, but they have problems getting it from the insurance company.
Exactly.
Is another issue. It's a huge.
Don't be afraid
problem.
to fight. Don't be afraid to speak up to your insurance company and demand something that's better for you. Just because your insurance company says no doesn't mean you can't fight and get your way. And ask your doctor to fight for you too. But understand, if you're taking an opioid and you're taking a sleeping medication for anxiety, and a lot of times they go hand in hand, pain medicine and anxiety medicine. And so if you take pain, anxiety, and there's one more. I think it's that's not a depression, but so it's depression, sleeping, anxiety, and pain. If you take those three together, that's called the Holy Trinidad. Most pharmacies will not fill those together because that is just a recipe for drug overdose.
It is. And mixing any of those together and also with alcohol,
yes,
there's a huge subset problem of middle-aged white women dying from alcohol and opioids.
Yes.
Overdoses from mixing the two.
I found an Ambien. If you take Ambien, you get up in the middle of the night and you do things you're not even aware of, and a lot of people are taking more pain pills, and they're overdosing.
Yeah.
So
that's a problem with the Ambien.
Yes.
Some people take Ambien for fun. And it's another thing is if you feel like you have a problem or you're addicted, you get help. And I understand the stigma around it, but I think human beings by their nature are usually trying to better themselves or better their situation, and taking care of an addiction problem is nothing to be ashamed of. It shows that you care, and it shows the people in your family and circle of friends that you care about them, and you're doing a good thing by getting help.
So understand also that when if you suspect you have a problem, absolutely have a candid conversation with your doctor, 100% first, and then from there, look at your options. There are other things. Suboxone, is that the proper word?
I think so.
Yeah, there are other treatments that will counter the opiate addiction and make the craving go away. There's also other things.
And give you safer and lessen your withdrawal.
Exactly, and if you lessen your withdrawals.
That's the part that's really, really difficult for people who haven't experienced anything like that. I myself have on a couple occasions through my colored past, that it is not you feel like you're dying inside. You hear voices, you're sweating. It is really, really unpleasant. And that's another thing is when you're feeling that horrible, the quickest way is oftentimes people aren't like, I need to get some help. They're like, I need to get this drug so I can feel decent.
Yes.
And then once they get the drug again, they go back into the cycle. And that's another problem.
That should be a huge red flag to you if you have to take a medication to feel better like that. That should tell you right there you have an issue.
Yeah, that should be a big red flag.
So I'm going to say this because we actually just like burned through 20 minutes. So I'm going to actually say this to people, and I hope you truly, truly understand. But you need to take control of your life right now. And if you are on an opiate or if you're on a pain management regime, trust me, you need to take control and you need to actively try to get yourself off these drugs, because sooner than later, and it's going to be much sooner than you want, these drugs are not going to be available to you. Or there's going to be all these thresholds put into place. And you're going to end up not having resources, or those resources are going to be saturated because so many other people are in your same boat. So be proactive right now and get yourself to a position to where you are not dependent on these opiate drugs for your pain management.
I want to throw in a quick shout out to the TurnTheTideRx.org website that's set up. It has a great bunch of numbers to help you realize the size of the problem, and it also has some great treatment options.
Awesome.
And
Much needed.
There's information for doctors and people in the healthcare profession on the website as well, and a lot of great resources like a pain treatment toolbox, treatment options, and all sorts of information. Or if you know someone that needs help, this might be a good website to give you a nice starting off point.
Say it again.
To help that loved one. TurnTheTideRx.org.
So TurnTheTideRx.org?
Yes, that is correct.
Awesome. And you can always call the clinic at 702-380-8118 if you have questions, or you can call up to the Nevada Primary Care Association office, and that number is, Jim?
775-887-0417.
There'll always be somebody available to talk to you and answer your questions, give you the resources you need, and help with the counseling. I wish everybody the strength to do what's best for them. It's hard. It's hard sometimes, but Jim's a perfect example of once you get over the hump, you can have a very wonderful, productive life.
As is Robert Downey Jr.
As is
on a much grander scale than I, but hey.
Well, you know what? I think people need to know that it's an individual thing. And if I was in that situation, I would just be beyond pissed off that I was giving the wrong information to begin with. And because you trust your doctors, you trust your pharmacies, you trust the big pharma manufacturers out there, and this has to do with misinformation on multiple levels.
Yes, and also a nice reminder to always just ask questions, question things.
Yes, exactly. So,
all right.
This was a quick one, Jim. So this is Tina Drago and Jim Godwin saying beware of opiates and call us if you need any help. Thank you.
Exactly. Stay healthy, Nevada.